Well, good afternoon. I'm pleased to be able to be with you all today to announce that Dr. Joseph Ladapo will be succeeding Dr. Scott Rifkes as the Surgeon General for the state of Florida. Dr. Ladapo comes with us by way of the David Geffen School of Medicine at UCLA. He is married. He has 3 children. He was born in Nigeria and immigrated to the United States with his family when he was 5. His father is a microbiologist and brought his family to the United States to continue his own studies. And the apple doesn't far fall from the tree because Joe has had a remarkable academic and medical career. He graduated from Wake Forest and received his medical degree from Harvard Medical School and his PhD in health policy from Harvard Graduate School of Arts and Sciences. He completed his clinical training in internal medicine at the Beth Israel Deaconess Medical Center, and his medical board certifications include internal medicine, American Board of Internal Medicine in 2011. He had residency at Beth Israel Deaconess Medical Center East Campus starting in 2011. As a physician in health policy research, his primary work has focused on patient-centered approaches to improving the health of individuals evaluated for coronary artery disease and behavioral economic interventions to promote sustainable cardiovascular health, including among adults with HIV. Dr. Ladapo also leads the health, economic, and quality of life evaluation of multiple NIH-funded randomized trials focused on cardiovascular disease and tobacco cessation. His national honors include the Daniel Ford Award for Health Services and Outcomes Research, and he is also a regular columnist for the Harvard Focus during medical school and residency, where he discussed his experiences on the medical wards and perspective on health policy issues. He comes to Florida with really a superb background. The floor is yours.
So I'm very happy to be in this position. Very happy to be joining the faculty of University of Florida also. And I talked to the governor, and there are a few things that we're going to keep in mind as we approach public health here in the state of Florida. So the first is that Florida will completely reject fear as a way of making policies in public health. So we're done with fear. That's been something that's been unfortunately a centerpiece of health policy in the United States ever since the beginning of the pandemic, and it's over here. Expiration date, it's done. So we're compassionate. We get it. There are scary things. We've seen a lot of fear from COVID over the almost past year and a half, and it's very understandable. But the way to approach that is not from a place of fear, because it doesn't lead to good decisions. And we've seen a lot of that, where the risks and benefits of decisions haven't been considered wholly or thoughtfully. So that's over here. In terms of our approach, we are going to have a positive approach. We're going to acknowledge the fact that there are some things that are scary, but that's not the only thing. That's not the place that we're going to make decisions from. So we're going to really think globally about the health policy decisions that we make in this state. The second thing that I plan to be sure is very clear in our policy making is that we're going to make it very explicit. We're going to be very explicit about the differences between the science and our opinions. So we all have opinions, we all have a perspective, and we are absolutely entitled to those perspectives. What's been happening over the past year is that people have been taking the science and they've been misrepresenting it. They've been using the science, and it's been unclear when the discussion about the science ends and discussion about how you feel about the science and what you want people to do with the science begins. And that will never be a problem here. That's never going to be something that we do here. You'll know when we're talking about data, and you'll know when we're talking about our opinions, our impression, our preferences about the data. That will always be clear here. So you can count on that. And then the third thing is that we are going to never lose sight of the fact that public health is not one thing. So public health is not about a single item. It's not about how many cases of COVID there are in a location. It's about, and that is a part of public health, but it's not the only thing. And as all of you know, that's how public health has been treated over the past year and a half. So that's over. It's not going to happen here. We're going to keep. We'll be interested and and concerned about all aspects of public health that we think are important. And that goes for, it goes for schools. So this, as just a perfect example of how glaringly we've ignored what public health really means has been how we've just brazenly pulled children who need the structure of school and need the structure of a routine in their lives out of school, and done that. And we've done that for not even, it's terrible to do it for all kids, but we've also done it for kids with disabilities and people who have hardly even batted an eye. So our interest in public health will truly be public health. It will not be sort of one thing or whatever the flavor for the month is going forward. So those are the main items I wanted to communicate to you all. And again, we're really excited about coming here to Florida. Really happy to be here.